Hi, I'm Dr. Janice Huntingford, and I'm an integrative veterinarian. Wanted to talk to you a little bit today about hyperthyroidism in cats. Now, this is a very common condition in older cats, and the thyroid is a gland that is a master gland, and it's found, there's two of them, they're found on either side of the trachea or the windpipe, and they help to regulate all of the metabolic functions in the body. But as the cats get older, they can develop a tumor on this gland, and then the tumor produces excess amounts of thyroid hormone. The clinical signs we see from this are cats that are losing weight. Usually they have a very good appetite and they're drinking a lot. They're producing a lot of stool, and many times they're getting quite thin, but they eat and eat and eat. And they will vocalize a lot, particularly at night. They wander around the house making a lot of yowling. Some of them are vomiting. So usually by this time, people are bringing them into the veterinarian to say, what's wrong with my cat? And with a blood test, we can tell that the cat's hyperthyroid. So how is this treated? Well, the gold standard for treating hyperthyroidism in cats is something called radioactive iodine therapy, where the cat is given an oral capsule, and this has to be at a special facility. And what that actually does is destroys the thyroid tumor and usually the thyroid as well. The cat has to stay in that facility until the cat's not radioactive any longer, and even after that you have to worry about the stool and the urine for about a month. Some of those cats then become hypothyroid and need supplement for that. The second treatment, conventional treatment for this, is going to be a medication called methimazole, which is a tablet that has to be given to the cat once or twice a day, depending upon how it does. You do need to check thyroid levels with the cat. It can go too low. It can cause issues with the blood cells, and some of the cats react to this medication and don't do well on it and have to be removed from it. The third conventional treatment is a prescription diet called YD, which is an iodine deficient diet. And that does work for many of these cats that are hyperthyroid. It does, however, mean that the cat has to eat this diet, and sometimes that just doesn't help. And sometimes the cats don't do well on that either. So how am I going to treat these? Well, these cats, sometimes I will treat with a combination of the methimazole medication and an herbal supplement from Pet Wellbeing called Thyroid Support Gold. Now, Thyroid Support Gold is really a natural way at looking at helping to reduce the clinical signs of hyperthyroidism, increase the quality of life of the cat, and make the cat feel better. It doesn't do an awful lot for decreasing the numbers that we see with the thyroid, but it does make the cats gain weight. It does make them feel better. And generally, that's what most of my clients want. Sometimes I will use it on its own, but many times I have to combine it with something else in order to control the hyperthyroidism. It does tend to be very palatable. Most cats will accept it. So that's how, as a veterinarian who's an integrative practitioner, I would look at treating hyperthyroidism in cats. See you next time.